Thank you for visiting my channel. Please remember to subscribe if you haven't. To those who have subscribed, thank you for visiting again. And today, I'll be going straight to a serious matter right now. There is a press release today by a group of scientists on this very good medication known as acetaminophen. It's nothing scary yet. More research will be done. Acetaminophen is known as acetaminophen in some parts of the world, particularly in North America, in US, Tylenol in Canada, paracetamol in so many parts of the world. Some other people call it Panadol, others will term it as Calpol, depending on the brand name available in your jurisdiction. And in some places, acetaminophen will be combined with aspirin under the name Excedrin. So, in other words, acetaminophen is found worldwide. And in fairness, acetaminophen is a pretty good medication. It has helped so many people, including myself. Today, something new is coming up, not for everyone, but for pregnant women only. Let's go. There's a warning. All pregnant women should no longer take acetaminophen without their doctor's approval. And even with the doctor's approval, they are now expected to take the lowest effective dose of acetaminophen, depending on the brand available in your jurisdiction. It might be paracetamol, might be Panadol, might be Tylenol, just the lowest effective dose, even with approval from your doctor, okay? And even with the approval from your doctor, you take it for the shortest possible time. Remember, this is a medication that is available over the counter. So, before now, a pregnant woman can grab a bottle and keep at home and use as she wishes. That has changed from today. Why that? There's a group of scientists that has released a statement today. Today means September 23rd, 2021, in my own local time right now. It might be 24 in another place, it might be 22 in another country, but 23rd of September 2021, a statement has been released by a group of scientists that we should be careful with the use of acetaminophen in pregnancy until further investigations are done. That is, we should be careful with the use of paracetamol, Tylenol, or Panadol in pregnancy. They also said that it is very likely that this medication, this very good medication that is very helpful, has some impact on fetus development while in utero, okay, while in the womb. The current focus and concern is on the impact of this medication on neurodevelopmental, reproductive, and urogenital disorders. They are not saying definitively that when you take Panadol, paracetamol, Tylenol, or acetaminophen in pregnancy, your baby will come down with all these problems, but they are working on the role of this medication in some of these troubles, in some newborn babies. So what is our expectation at this time? Because we cannot just throw the alert out there and expect everybody to be running scatter. No. More investigations will drive home the above stand of this group of learned people, okay? Or more investigations will refute it and will be back to status quo, okay? The use should be limited to as it is so necessary in a pregnant woman. So this has nothing to do with other group of people, okay? Nothing to do with non-pregnant women, nothing to do with men, nothing to do with the way you are using it in children. But a woman that is already pregnant, then there is caution right now that we must take. We must be careful in a pregnant woman right now. And when you are confused, please grab the phone or just send it, your fax or your consult to the OBGYN specialist in your jurisdiction or your pharmacist or both. Some will be saying, who are these scientists just raising alarm? They are not just raising alarm, no. And they are serious people, but there's no conclusion yet. So more research will be done, more investigations will be done to establish this or debunk it. So the scientists, 91 of them are from United States, Canada, Europe, United Kingdom, Israel, Australia, Brazil, and Scotland. For now, what should we do? I'm not saying this so that we can be running ether-scatter. We know the population group targeted right now, pregnant women only. Okay, then if you have had anything new, whether it has been established or it has been debunked, please leave comments or comments for me. I will also publish anything new once I have such from the news or from my colleagues. Any changes, please contact me, and once I have it, I'll publish it. My old presentation on acetaminophen is right here. So from the next slide until the end of this presentation, you'll be listening to my former presentation on acetaminophen. Okay, but if you don't want to continue listening here and you just want to jump to the old presentation on acetaminophen by me alone, you can click on this very link. With that, I'm saying a big thank you for giving me the audience, and please share this with every woman of childbearing age. Thank you. I appreciate it. Hi everyone, I want to talk about acetaminophen. Acetaminophen. You have heard about that. You have used now, like in North America, it's Tylenol. In some other parts of the world, it's paracetamol. So different names, different brand names, but the generic name remains the same, acetaminophen. Acetaminophen is a non-opioid analgesic, and we need to take note of the maximum daily dose. For example, you can give anything between 3,250 milligrams to anything less than 4 grams per day. It could be given at the rate of 650 milligrams at every 4 hours to every 6 hours. There is an extended release form that can be given as high as 1,300 milligrams every 8 hours to maximum of 3,900 milligrams per day. The rectal or suppository forms could be as high as 650 milligrams, and that could be administered every 4 hours to maximum of 3,900 milligrams per day. If the patient is less than 50 kilograms, you can give acetaminophen intravenously at the dosage of 12.5 milligrams per kilogram every 4 hours or 15 milligrams per kilogram every 6 hours. You can see that when the frequency reduces, the dosage increases, like 12.5 milligrams every 4 hours. Compare that to 15 milligrams every 6 hours. But if the individual is greater than 50 kg, you can give as high as 650 milligrams every 4 hours or 1,000 milligrams, that is 1 gram, every 6 hours. Again, you can see the disparity here. The lower the number of times you can give it per day, the higher the possible dosage you give at a time. For children, you can administer anything between 10 milligrams to 15 milligrams per kilogram per dose. And you can also give that every 4 to 6 hours with maximum of 80 milligrams per kilogram per day. and adults can also take 325 milligram to 1000 milligram every 6 hours or every 4 hours with maximum 4 gram per day. Half-life of acetaminophen is 2 to 4 hours. And that's why the prescription is talking about 4 hours or 6 hours, repeated dosing. Acetaminophen is known worldwide and is in different products and brand names. It was introduced in 1955. It is used as antipyretic, analgesic, and is very safe at the standard dosage or therapeutic dosage. Overdose leads to hepatic necrosis, which could be fatal or non-fatal. Its effects leads to liver failure. Toxicity with acetaminophen is aggravated with alcoholism, other concomitant drugs ingested, and underlying liver pathology. There are different preparations of acetaminophen. Extended release capsule, for example, Tylenol arthritis pain, extra strength tablets or extra strength capsules or extra strength caplets or gel caps, types in form of 325 milligram and those in form of 160 milligrams are available. Chewable tabs are at the dosage of 80 milligram per tab and 160 milligram per tab. The liquid form or syrup or elixir suspension is about 160 milligram per 5 ml or 33.3 milligram per ml. It could also be in form of drops, suppositories, or intravenous solution at dosage of 10 milligram per ml IV. While prescribing or taking acetaminophen, many will be concerned about the possible liver damage, but if it is taken within the therapeutic range for therapeutic purposes, it's not likely that you have any problem with your liver if there is no any other pathology prior to that. But there will be a problem when excess is ingested, and liver damage will be dependent on the following factors. 1. If there is very high intake of the said acetaminophen, then you can expect liver damage proportionately. And if there is unavailability of N-acetylcysteine, to those who are not familiar with that, N-acetylcysteine is the drug of choice to deal with acetaminophen toxicity or poisoning. In other words, that is the antidote. So when the antidote is not available, then the liver parenchyma or liver necrosis will be worsened. Also, if there's excessive activity of cytochrome P450, that is a type of liver enzyme. When it is induced, then there will be massive damage to the liver. Also, decreased level of glutathione, which is expected to protect cells by deactivating the radicals, will become a big problem when the level is down. It means radicals will have free there and more damage will be to the liver cells. The age of the affected individual is a big factor. It's going to be worse with the elderly. So the older you are, the worse the possibility of liver damage when you take it in excess. For example, if a young man and an elderly man should take the amount of acetaminophen in high dosage the same day, the same hour, we are not likely going to get the same outcome, because it's likely that the elderly man will have more trouble and more signs and symptoms of liver damage compared to the young individual. The use of alcohol at the same time with acetaminophen will worsen the situation. Also, the use of other medications or street drugs will aggravate the situation. Comorbid illnesses like other diseases in the individual, like renal failure prior to the time of ingestion, will make the situation worse. Nutritional status, somebody that is nutritionally deficient will suffer the most. And of course, genetic constitution, because that's what they even call idiosyncrasy, which means we react in different ways based on genetic constitution. What are the possible features of poisoning here? The first 1 to 24 hours, there's going to be nausea and vomiting, sweating profusely or diaphoresis, pallor, lethargy, malaise, or can even be asymptomatic. When laboratory investigations are taken at this time, it's likely going to be within normal range. After 24 hours to 4 days to 2 weeks after, that is recovery stage, with full recovery at day 7. Symptoms may still be present and lab values are not normalized yet. Acute hepatic failure will lead to acute renal failure or a scenario known as hepatorenal failure. Treatment antidote is N-acetylcysteine, like I've earlier said. We're going to determine that by time and serum acetaminophen concentration. Then we're going to take sample after the first 4 hours to know the level of the acetaminophen in the serum, because that is going to determine the treatment line using modified Roux-Marc-Mathieu nomogram. We're going to repeat samples after 4 hours after the first sample is taken. Then, using modified Roux-Marc-Mathieu nomogram, we'll start our N-acetylcysteine when the level is reached. In conclusion, for the moment, treatment of toxicity will be the next video. I will come with Roux-Marc-Mathieu nomogram and everything we need to do for anyone that is having acetaminophen poisoning for reasons best known to the affected individual. Thanks for listening to my presentation. Kindly subscribe so that you can get these publications immediately they are released. Thank you.